In this video, we will explore 8 sneaky symptoms of osteoarthritis to catch early before irreversible joint damage sets in. According to the Centers for Disease Control and Prevention, CDC, osteoarthritis is the most common form of arthritis and a leading cause of disability affecting over 32.5 million adults in the United States. It results from gradual wearing down of the cartilage cushions between joints over time. Eventually, the protective cartilage erodes enough to allow bone-on-bone friction and spur abnormal bone growths. Many people falsely believe osteoarthritis is an inevitable result of aging that you just have to limp through. But while age is a risk factor, osteoarthritis can also occur in people of any age. In fact, various influences like past injury, obesity, poor posture, genetics, overuse through sports or work, and joint malformation can all cause or increase the risk of osteoarthritis. This degenerative joint disease worsens gradually, with early symptoms developing slowly over years before joint damage becomes severe. If left unchecked, osteoarthritis can severely erode cartilage and bone, leading to joint deformity, loss of mobility, and major disability, which may require surgery or joint replacements. If you want to check for osteoarthritis progression, stick around and watch this video all the way to the end. We'll also discuss some simple lifestyle changes to help reverse joint damage and keep them healthy. First symptom, joint pain. One of the most common early signs of osteoarthritis is joint pain, especially during or after movement. At first, the joint discomfort may only occur when you engage in certain activities like climbing stairs or standing up after prolonged sitting. But over time, the pain can become more persistent and widespread. While osteoarthritis pain can affect any joint, it frequently targets weight-bearing joints like hips, knees, and facet joints in the spine as well as hands. It usually starts gradually as a mild ache, but as the cartilage wears down further, joints hurt more sharply during activity. If you develop new or worsening joint pain that persists for several weeks, especially combined with difficulty moving the joint, see your doctor to check for osteoarthritis. Another common symptom of osteoarthritis is joint stiffness, particularly in the mornings. As a result of not moving while sleeping, fluid can accumulate around the affected joints, and the cartilage loses some elasticity overnight. This causes temporary morning joint stiffness that tends to ease up gradually within 30 minutes of getting out of bed and moving around. However, if it lasts over half an hour, even after using the joints, takes a greater effort to loosen up, or happens later in the day after long periods of inactivity, that points more towards an inflammatory arthritis. Brief morning joint stiffness alone can happen in normal aging too, but combined with joint pain that gets worse over weeks to months, consider getting examined for possible osteoarthritis. Let your doctor know if morning joint stiffness is interfering with your daily function. Sign number 3, reduced range of motion. As osteoarthritis progresses, the erosion of cartilage and increased friction within joints impairs mobility and flexibility. Everyday movements that once felt easy require greater effort and can even become difficult to perform. Actions requiring joint rotation, like turning doorknobs, looking over your shoulder when driving, reaching overhead shelves, or bending to tie shoes gradually become more challenging. The knees and hips tend to lose range of motion significantly, but other common sites of reduced mobility include the shoulders, fingers, neck, and lower back. You might notice osteoarthritis-affected joints simply won't move as far as they used to regardless of stretching and warm-up. This worsening stiffness and loss of flexibility isn't something to just write off as part of normal aging. Checking in with your doctor can confirm whether these changes indicate developing osteoarthritis versus other joint problems. Next symptom, swelling or inflammation. Another symptom of osteoarthritis is swelling, warmth, redness, and tenderness around affected joints. This reflects inflammation of the joint lining as a result of cartilage breakdown and debris floating in the joint space. In severe cases, significant fluid can build up inside the joints, causing tense swelling that maintains shape when pressed. While joint inflammation suggests osteoarthritis has progressed enough to disturb the joint space, detecting it early helps guide treatment to settle inflammation before it causes further joint damage. So, tell your doctor about any apparent joint swelling, heat, or fluid buildup so they can determine next steps. Joint instability is another symptom of osteoarthritis. As osteoarthritis erodes the cartilage pads cushioning joint ends, the joints can become structurally unstable. This causes looseness of joints or a feeling they might buckle or shift position. Knees in particular often develop an unstable, wobbly sensation, making people feel uncertain on their feet and prone to falling. Hips also frequently loosen and pull in odd directions because worn cartilage no longer holds the ball and socket together properly. When it occurs in the spinal joints, it can also reduce back stability. So, be alert to any joint instability, looseness, or giving way which signals advanced osteoarthritis. Development of bone spurs is another sign of osteoarthritis. Bone spurs often develop around affected joints, as the body tries to stabilize joints destabilized by osteoarthritis cartilage loss. These bony projections extend partially into the joint space from the edges of bones near badly damaged cartilage. Unfortunately, bone spurs themselves may narrow joint spaces further and irritate nearby tissues. In addition, bone spurs can restrict joint mobility even more. There's no way to remove bone spurs without surgery, but some medications can ease related inflammation. Symptom number 7. Joint crepitus. Osteoarthritis also frequently causes grinding, clicking, or cracking sounds in affected joints, known as crepitus. These crunching joint noises happen as roughened bone surfaces rub together, lacking smooth cartilage cushioning between them, which also contributes to osteoarthritis pain. Knees and shoulders commonly pop or grind, but noise and abrasive sensations can come from small joints too, like fingers hardened with osteoarthritis. While occasional joint popping on its own can be harmless, repeat crunching grinding warrants an exam for potential osteoarthritis joint surface damage. Formation of bony lumps is another symptom of osteoarthritis. As osteoarthritis advances in the small joints of the hands and feet, visible bumps resembling knobs can develop on top of fingers or toes, ranging from pea-size to noticeable enlargements. These firm nodules are called Heberden's nodes on finger joints and Bouchard's nodes on middle finger joints. They form from bony outgrowths caused by localized inflammation and cartilage breakdown right within those finger and toe joints. Nodes may feel tender when pressed and can ache when moving the affected digits. They typically progress slowly over years, but become permanent joint fixtures. Although nodes themselves are non-dangerous, pay attention if they emerge because they represent worsening osteoarthritis in those precise finger or toe joints. Catching them early allows quicker intervention to protect remaining cartilage from further damage. If you develop early signs of osteoarthritis, early conservative management can help to protect joint structures, control symptoms, and improve function. First, reach out to your doctor for the right medications to ease swelling and pain. For more advanced osteoarthritis, prescription anti-inflammatory drugs, injections, surgery, or joint replacements may be required. 2. Stay active with low-impact exercise to preserve joint mobility and strengthen supportive muscles without overtaxing damaged joints. 3. Consider physiotherapy, which helps to build muscle tone and retains flexibility through a range of motion exercises. 4. Try to maintain a healthy body weight which minimizes stress on joint cartilage. Also, quit smoking, as it worsens cartilage damage. 6. Take supplements like fish oil, green tea, and ginger, which may help to relieve symptoms of inflammation and joint pain. However, check personally with your doctor first to ensure you don't have any conditions such as an allergy where any of those is not recommended. Catching osteoarthritis early maximizes treatment options to alleviate inflammation and pain, improve joint function, and slow the progression of the disease. If you notice potential osteoarthritis clues like those covered in this video, schedule a medical evaluation right away, even if symptoms seem minor now. Don't write off recurring joint troubles as just part of aging. Get checked out so you can actively manage osteoarthritis before major irreversible joint damage occurs. I appreciate you taking the time to learn about the common yet overlooked signs of osteoarthritis. If you found this information helpful, I kindly ask that you take just a moment to like the video, subscribe to my channel, and also share it with others. This allows me to continue producing more content focused on keeping you safe, healthy, and well-informed. I look forward to seeing you in the next one. Take good care until next time.